Hey there, how are you today?
I'm doing well. How are you?
Good. What's your name?
Brooke Haynes.
Nice to meet you, Brooke. My name's Julie Haynes. I'll be your nurse working with you today.
It's nice to meet you.
All right, how's it going today?
Pretty well.
Curtain right here, give us a little bit of privacy, okay? All right. So tell me what brings you in to see me today.
I'm here for a wellness check.
Okay.
Just checking
All right. What you need a wellness check for?
For just everything.
Just a yearly
Just a
going
yearly,
on.
like
Okay.
yearly checkup.
All right. Good deal. All right, so with yearly exams, what we like to do is do a full history on you, see what's going on, what you got, any medical disorders, issues going on, and then I'll do an assessment on you, just take a peek and see what we got going on, okay? All right, so tell me a little bit about yourself.
I'm 18.
Okay.
And I'm in high school, at least high school.
All right.
I play a lot.
Is this your senior year?
Yes, ma'am. I graduated.
Exciting.
I've only got like 4 months left.
Wow.
It's kind of crazy.
Goes by fast, doesn't it? What about any college plans? What you got for future graduation?
I play a lot of sports. I play softball, basketball, volleyball, and I got the opportunity to play at the next level for softball.
Yay.
So I got a scholarship to play at junior college at Mary Military Institute. So I'll be playing there for the next 2 years after I graduate. So.
Hey, having a plan's half the battle. Good for you.
Yeah.
I see you're in a boot today.
Yes.
Can you tell me a little bit about what happened there?
It is basketball season, and so I'm a really tough athlete. So I play most of the time. I play like on the floor. My mom, she jokes around with me all the time, but
yeah, you do know basketball is meant to be played on your feet, right?
Yeah.
Okay.
Okay. But yeah, I rolled it a few times throughout the season. I rolled it in the game twice, in 2 different games. And my mom, like ever since I was little, she's like, "You gotta take care of yourself. Like, put your braces on and do this." And I'm a typical teenager and don't do what I'm told sometimes. And I didn't have my braces on when I rolled it the first 2 times in the games. So I put my brace on just on the bad foot that I had. And I did roll it through the brace in practice about a week ago. So I've been in the boot for a week. I went to see a doctor about it. His name's Dr. Carter.
Did you say, okay. Dr. Carter. Where's Dr. Carter located?
Andrew Sports Medicine.
Okay.
I saw him at the Trustful location.
Okay.
And he recommended me to go in physical therapy for 2 weeks and possibly try needling and ice and ibuprofen as much as I can throughout the day because it's something that's just it's a day at a time. So he said that as long as I'm like doing what I'm supposed to, then I should be out of the boot fairly quickly.
Okay.
So
did therapists talk to you about what we call RICE, rest, ice, compression and elevation?
Yes.
Okay. All right. How often are you doing that?
Yes, ma'am. I do
How often
20
a day are you doing that?
on the ice thing. I do 20 on, 20 off, but I usually ice about 3 times a day.
Okay.
He did give me a few exercises to do, like write my ABCs, like capital letters, lowercase letters. I've been doing that. It's okay on my foot. It's getting better throughout the day. So I do take Motrin, ibuprofen twice a day. So.
Just make sure you keep all your physical therapy appointments. You make sure you keep follow up with him because these injuries can be long term to deal with if we don't make sure we follow treatment. So any follow up you'll need with that, just make sure you reach back out to Mr. Carter or Dr. Carter, excuse me. Okay. All right. So tell me a little bit about medical. Do you have any medical disorders or any?
Yes,
have you ever been diagnosed with any medical problems?
I have type 1 diabetes.
Okay.
I was diagnosed when I was 4 in June of '06.
Okay.
So I'm 18 now, so it's been about 14 years I've had diabetes. I do go to usually like checkups through that. I do see a regular doctor. Me and my mom are seeking a new endocrinologist because I'm 18 and I go to Children's now. So me and her are looking to find somebody else to go to for right now. Until I go off. So I don't know what we're going to do since I go off to college. I don't know if we're going to find someone down there. My college is about 2 hours away, so I don't know what we're going to do there. I may just come back. So it's just planning through there.
Well, you know, college life's kind of hard sometimes to keep up with.
Yeah.
So one thing that we definitely are concerned about, you know, would be once you get in that environment, making sure that you do see somebody. You know, usually endocrinologists will recommend that they see you at least every 3 to 4 months. Depending on how compliant the patient is, sometimes it may be a little bit further than that, maybe 6 months or so. So making sure that you keep those appointments and that you do have somebody, that you see regularly. So tell me a little bit, would you consider, how well do you manage your disease, I guess, your diabetes diagnosis?
I'm going to be completely honest with you.
Please, that's what I now need you to do.
I am a typical teenager.
Okay.
Some days I have my days and I have days here and there. I'm not as compliant as I should be.
Okay.
I am looking at and trying to fix, like, check my blood sugars more during the day, especially on game days when I have games and sports and stuff like that, making sure I eat healthier and check my blood sugars more and take my insulin because if my blood sugars are running high, especially on game days, like, I just don't perform to the best of my ability. So being able to manage, like, a well blood sugar throughout the day and even in a week's advance of a game.
What would you say your average blood sugar is? Have you had an A1C drawn? What was your last A1C?
Yes, my last A1C was done last August, and it was a 13.1. Not very good. Yeah. I'm not sure what this.
Do you know what the average blood sugar is for a 13.1?
No.
It's 350. Yeah. So, I don't know as far as how much education, I'm assuming tons through the years that you've had, but, you are getting older. So one of our things that we talk a lot about is diabetes is a chronic health condition, but there's so many other chronic health conditions that come sometimes due to not managing your blood sugars. So in order we try to avoid heart disease, kidney disease, those kind of things, problems with your eyes, the lower we keep that A1C, research shows that we keep away those other things. So, my encouragement to you would be, you are 18, you have had this disease process since you were 4. So we're talking about 14 years. What are we looking at 14 more years down the road if we don't try to get more compliant? I can only imagine how hard it can be, as far as managing. I know you got a busy schedule with softball, basketball, volleyball, and that's probably why. Have you had any other issues with diabetes as far as ever had DKA or any other medical problems related to diabetes?
My doctor had warned us that when I start my menstrual cycle, at the time I was 12 or 13, that my blood sugars would run higher on my menstrual cycle. And
so when did you start? So you started your cycle at about 12 years of age?
Yes,
12 or 13?
13. Yes,
okay. How old? Do you remember how old you were?
13, 12. 13.
Okay.
And that's when I started my cycle, and so my blood sugar had just shot through the roof, and we didn't realize that it was too late to realize that it had already taken control of my blood sugars, and so that did result in me going into DKA. And so my mom took me to St. Vincent's East. They ran tests there. I just did test positive for DKA, so they transferred me by ambulance to Children's Hospital.
Okay.
I don't really remember anything else past that point because I was so delirious and unconscious at that time. So, but my mom did explain to me that I wasn't in the right state of mind at all, and I almost died those past years. So,
How'd that affect? How do you think that affect you? Did it affect you emotionally?
Yes, crazy. It's like, I could have died and there's nothing I could really do other than,
Sure.
But that made me realize that, like, I had to take care of myself. Like, I had to.
Have you had any more issues with DKA?
I've never been in DKA.
Okay.
The doctor did explain to me at Children's when I was there that
I'm just making a few notes. We just want to go back and do your history. Okay.
she did explain to me that my body is not used to the DKA and anything like that, that severe. So she said that if I were to ever go back into it, at any point in time, that my brain could just shut down because it can't handle that at all. So it kind of scared me a little bit, but
DKA can be very dangerous. They're very correct. That's basically a state in which glucose is supposed to fuel your body. So when we take in carbohydrates and sugars, but carbohydrates all equals sugar basically. So sugar is designed to go inside of our cells, so it's our fuel for our body. But what happens when it's not inside the cells, it circulates around in our blood, and it could cause us to be in what we call an acidotic state, okay? Which basically is just a fancy word for saying our body can't handle that. It's not designed to live in that environment, so it can result in like respiratory failure, like where you can't breathe, and it does if we're not getting blood sugar or sugar into our cells for our organs to function. And one of our major organs is our brain. Without fuel of our brain, neurodeath or brain death can occur. So definitely, the concerns that your medical team talks to you about are definitely warranted. So and of course you're getting older, so you're getting more independent, and there's not going to be everybody there to go, Brooke, you need to do this, Brooke, you need to do that. So we want to encourage you for sure, but I do definitely want you to understand the severity of what your disease can bring. But guess what? There's patients that live happy and healthy lives every day with the disease process that you have. So it's not something, as much as I can only imagine how frustrating it can be, but at the same time, I want you to know that you can live a very healthy life with your disease process. It's just all in how healthy and how happy you want to be with it, okay? So definitely, I'm going to encourage you moving into, and I can only imagine how you feel. You're going from this teenager type phase to now you feel like you're going to be going to college and you got a lot of independent things going on. There's such a freedom in that, but I encourage you just stay grounded. That freedom is a great thing, but at the same time, we've got to still do what we need to do, okay? Because we want you to live a long, healthy life. So definitely trying to make sure that you wrangle in that compliance, okay? Especially if we got blood sugars in the 350s, okay? So are you taking insulin? I'm assuming you're type 1 diabetic. Can you talk to me a little bit about your diabetes management, what the plan is between you and your team?
I take Novolog 3 to 4 times a day with every meal, every snack.
Novolog. Do you take a certain amount of Novolog?
Yes.
Or tell me how you dose that?
Depending on the carbohydrates, like on each thing that I eat, it's 1 unit every 8 carbs.
Okay, so you have an insulin to carb ratio?
Yes.
Okay. So insulin carb ratio. So you said 1 to 8?
1 to 8.
Okay. All right.
I also take Lantus at night. It's overnight medicine. I take 50 units of that every night. And that's just to keep me stable throughout the night because the Novolog is a short-acting insulin, and the Lantus is a long-acting.
Sure.
So it gets me through the night.
Okay.
I also take Celexa for anxiety and depression sometimes.
Okay. So you have Celexa. Do you know your dose of Celexa?
I think it's 50 milligrams or 5 milligrams. I'm not
We
sure.
usually dose it 10s, 20s, 40s.
It's the smallest dose, so I would say about 10.
Okay. Okay.
I take that once every day, and I take it before I go to bed.
Okay. All right. So you said, you take that for what now? What is that for?
Anxiety.
Okay. How long have you been taking that?
I used to have like really, really bad anger issues and struggle with coping with everything. So I just now got on the medicine about a year ago. With the help of others, me and my mom were seeking help with counselors and stuff like that, and I was able to find one and get the help that I needed. So I'm a lot better with the medicine. I feel Like I'm in control of myself and can handle any situation that comes my way.
Awesome.
I have, with my diabetes, like I'm a little non-compliant. I'm a little non-compliant on the medicine. Sometimes I'll forget to take it, and I can tell when like I don't take my medicine. The next day or the day after that, like I get really short-tempered, and so I can tell with a difference when I'm on my medicine, when I'm not, and the medicine really helps me out a lot. I just have to be diligent with it and take it every day like I'm supposed to.
Well, one thing I will tell you, with any medications that we take that help our brain, sometimes, and lots of patients struggle with this, but they have sometimes depression we go through, situational depression, sometimes just a medical diagnosis of depression or any mental health disorder. Sometimes our neurotransmitters in our brain, our chemicals in our brain sometimes are off a little bit. Some people it's chronically, some people it's just for a short amount of time, but when those medicines are designed to kind of fix that and put all that kind of back in place where it needs to go, but it's very dangerous to come on and off those medications, okay? It takes our brain time for those medicines to work, and then it also takes time for those medications not to work whenever the physician and you decide, hey, I think we're good without this medication, but you can cause some serious side effects with that, especially antidepressants. They're designed to kind of regulate your serotonin levels. So if we are taking our medicine and then not taking it, and taking it and not taking it, it can cause something we call like a serotonin storm, and can really cause some major problems. So never, ever, ever stop taking a neurologic medication without consulting your physician first, okay? Because generally, most of the time, and this is not all cases, but most of the time, we do like for you to taper off those medications, not just stop cold turkey, so we avoid any type of neurologic damage, okay? So I would just encourage you, try your best any way that you can. Set an alarm. I see you got an Apple Watch, so I'm assuming. Yeah, we tend to do that with our kids sometimes. So I'm assuming you got some good phone technology, Apple Watch. There's you can set appointments on calendars, reminders, set an alarm, something to definitely remind yourself. Okay, so to make sure you take those, just for your safety. We want you to be as safe as possible. Okay. So I see you said you're on Novolog, 1 to 8 carb ratio, 1 unit to every 8 carbs, and you're on Lantus, 50 units at bedtime, and then Celexa. Are you on anything else currently?
Just ibuprofen and Tylenol for my injuries.
For your injuries.
Yeah.
Do you take that all the time, or is this just for injury?
It just depends. It really depends. Depending on whether I'm in season or not. My muscles. I'm a catcher in softball, so my knees and ankles. I take medication for them, just ibuprofen, Tylenol, here and there, depending on whether they hurt or not.
Do you know the dosages on those?
I take 800 milligrams of ibuprofen and 500 milligrams of Tylenol.
Okay. PRN?
Yes, ma'am.
Okay. Be careful sometimes. Ibuprofen and Tylenol, they're wonderful for pain relief, but you have to be careful and be cautious with those. So ibuprofen, you should never take more than 2,400 milligrams in a day. Okay. It can be kind of hard on our kidneys. It can be tough on our stomach sometimes too. Tylenol, never take more than 4,000 milligrams in a 24-hour period. Okay. It is very hard on the liver, so you need to be careful with that. Okay. But yes, they're great pain relievers, but we just want to make sure that you're taking them safely. Okay. So in 24 hours, no more than 2,400 milligrams of Motrin, and in 24 hours, no more than 4,000 milligrams of Tylenol. Okay. And if you don't remember that, we'll try to get you some literature before you leave today. But just make sure, call the physician's office and see if they can remind you. Okay. All right. So we're Novolog, Lantus, Celexa, ibuprofen, and Tylenol.
Yes.
Okay. Anything else?
No.
Okay. All right. Are you on any type of birth control?
Yes.
A lot of young girls forget that sometimes.
Yes.
Yeah.
So about 2 years ago, I suffered from cystic acne. So I would get cysts all up and down my back.
I see you got a little bit going on.
Yeah, on my
right
forehead.
here on the forehead today. Okay. I'm sorry, I'm just going to take a look while we're talking about it. Okay. Looks like these are just small. What did you do for your cystic acne?
I was put on Accutane. My mom took me to the dermatologist.
Is this the only place you got acne?
I have some down here in my area, but
In your area? Okay.
yeah. They're, I don't know. I get them sometimes. Up under my arms. I have one right now. Actually, it's up under my.
Is it acne or is it like boils?
I think it's like boils.
Okay.
More so like boils than acne. But I was put on.
Can you take this shirt? Pull the shirt up a little bit for me.
I was put on Accutane. Excuse me.
Sorry.
No, you're good. I was put on Accutane for about 6 months, I believe. And so I had to have 2 forms of birth control. And so I had abstinence, and my mom took me to have a Nexplanon because I'm not really compliant with pills. So she recommended, my doctor recommended that I had a Nexplanon put in my arm.
Okay.
So I have it's a little rod thing that's in my arm, in my left arm. And I think I have to change it like every 3 years. So I've had it for about 1.5 to 2 years now.
Yeah, it's a progesterone only based birth control.
Yeah.
Yeah, we see that often. So, okay, yeah, it looks like those are not really acne. They're just little like infected, and sometimes they get irritated. This looks actually pretty good. It looks like it's on the healing end of it. They are like little cysts that do come up, and they tend to come up in areas that rub and have a lot of tissue together. So acne, you said here, and you have, is this the same thing in this area down here?
Yes.
Okay. Have you seen anything? Have you seen anybody for that, or anybody been treating that?
No.
Okay. I'm just going to take a look over your skin while we're talking about that, and just.
I think I have.
Do you mind if I take a look at your back?
Yeah, you're good.
Okay.
I have little skin tags on my back from the acne.
These are scars, sweetheart. They're called keloids. Yeah, and sometimes it's just scar tissue. Some people have an overgrowth of scar tissue. Your back looks pretty good, actually. Yes, you do have the little scarring spots, but nothing major.
I used to get like really, really bad cystic acne on my shoulders. But once I took that medicine, it started clearing up really bad, and I haven't seen any.
So you have a history of Accutane therapy?
Yes, ma'am.
Okay. How long were you on Accutane?
For about 5-6 months.
Okay.
And I had to follow up with the doctor every month, and I had to have labs drawn every month, and a pregnancy test done to make sure that I wasn't pregnant while I was on the medication.
So you don't have any other, so we talked about your diabetes, we talked about your anxiety disorder. You were diagnosed about a year ago. Am I hearing that right? You have been on medications and counseling or therapy with that? Okay. And you're feeling better, or?
Yes, ma'am.
How is that?
Overall, I'm feeling much better with the medications that I take. With diabetes as well.
Okay. Have you ever, sometimes with depression and anxiety disorder, especially with teenagers, we tend to, suicide can be somewhat of an issue, or suicidal thoughts and tendencies. Have you ever had any of that?
No, ma'am. I've never thought of anything like that at all.
Perfect. Just always try to make sure if any of that comes to mind, definitely seek help immediately, okay? Okay. But sometimes our brain likes to just kind of go a little haywire on us sometimes. So, and that's human. Sometimes folks battle that some, and doesn't make you any different than anybody else. We just want to make sure we get you help as soon as we can to avoid anything major happening. Okay. So no other medical disorders that you're aware of. Nothing from head to toe. So other than generalized anxiety disorder, we don't have any other neurologic problems. How about your eyes? Any issues with your eyes that you're aware of?
I go to the eye doctor pretty regularly. I do wear glasses if needed at night. I have astigmatism, so Dr. Pulliam in Leeds, where I go to, the family eye doctor, he has me on has glasses for me, so I wear them at night when I'm driving.
Okay.
To keep the glare away from
Okay.
the lights.
So you do wear glasses. You have astigmatism. Okay. How often do you see the eye doctor?
Twice a year. Twice a year.
Okay.
And then whenever he needs me to come back.
Do they dilate your eyes?
Yes, ma'am.
Okay. Yeah. Usually with diabetics, they make sure they do a thorough exam.
Sometimes I went to the doctor like 5 months ago. Because when I was playing ball, I really couldn't see the ball because it's I'm a catcher, so the ball's coming in really fast, and I couldn't see when I was batting. It was kind of blurry. So I did get sport glasses. I don't wear them like I should. Once again, I'm all over the place. So, but yeah, I do wear them if needed on the field while I'm playing.
Well, let me let you in on a little secret too. So when our blood sugars are high, it'll cause the eyeball to swell. And guess what? Our lens on the front of our eyeball, it manipulates what we see. So it's not uncommon for diabetics with high blood sugars to have blurred vision like that. So if you keep your blood sugars in a tighter control, what is the blood sugar your physician wants you to be at? What do you?
100 to 110.
Okay.
Really,
which is normal. Which is in a normal range.
Really, 90 to 120.
Yeah.
It's a good blood sugar.
Yes. So if we can keep you there, some of that may, not that the astigmatism is going to go away per se, but some of that intermittent or that come and go blurry vision that you're talking about, that can sometimes help. Okay? All right.
Kind of like all the medical stuff, like they just like link together.
It does, and in medicine, cool. Yeah. That's why I do it. I love it. Yeah. There's so much. The human body is such an intricate machine. It's pretty amazing. But sometimes if we can understand, because I can only imagine, especially at your age and as long as you've been dealing with medicine, so to say, it can be overwhelming, and it's just like, it's almost like a broken record. You kind of hear things over and over. But I will say you're getting older, and that you're making sense of it. You're exactly correct. It all does kind of link together. So really now is where you need to try, or we need to help you wrangle in all that information so you can really see how it can help you. If we get you on track where you need to be, how much better, you'll really feel, and how they all do link together, because diabetes really is like that. It links everything in together, so to say, as far as medical disease process. So we definitely want you on the better end of compliance for sure, okay? And taking in all this information from these different providers that are handling different things for you, from the healing process of any broken bones, damages, to making sure your eyes stay healthy, making sure your body as an overall whole stays healthy, okay? So other than the diabetes, other than the anxiety disorder, nothing else you can think of. And eyes, heart disease, any type of heart disease, any problems with your heart, you feel awkward, everything feels normal. You breathe in, have any shortness of breath, dizziness, weakness, anything like that.
The only time I ever feel like dizziness and weakness is when my blood sugar's low, of course.
I'm going to take a few minutes while I'm asking you and just kind of going over what we call a review of systems, essentially. I just want you to tell me any abnormalities or anything you've been having going on, okay? So no shortness of breath at all, okay? All right. I'm going to ask you to kind of breathe in and out for me here for a few minutes, okay? I'm just going to take a minute and listen to your lungs, okay? Take a big deep breath in for me and blow it out quickly. Okay, big deep breath in for me. Blow it out quickly. Okay, we'll move to your back, honey. Okay, take a big deep breath in for me. Blow it out quickly. In. Okay. When I ask you to blow it out quickly for me, I want you to take a big breath in and out, okay? Because sometimes if there's others like wheezing going on or something a little bit harder to hear, that forceful air out will let me hear it a little bit better, okay? All right, big breath in. Okay, again. 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 Okay. Again. I'm just going to come right up under here, okay? Okay, big breath. All right. I know, I'm wearing you out, aren't I? Okay, take a big breath in. Okay, perfect. That all sounds good. Nothing unusual at this point that I hear. And now I'm going to take a listen to your heart. I just need you to breathe normal for me, okay? That sounds good to me. Okay, lift your arm up for me and just put it behind your head for me, okay? I'm going to take a listen right up under your shirt. Are you okay with that? Okay, you can bring your arm back down. Just breathe normal. Okay. Hey, everything sounds good there. I'm just taking a minute doing all because I want to, this is what we call your PMI, or maximum pulse point of impact or impulse, and then just listening to the different valves of your heart.
Am I good there?
Yeah, everything sounds great. It sounds great. So no feel like your heart's running away with you, fluttering, nothing like that.
Mm-hmm.
Let me take a look at your fingers right here. Take a big deep breath in for me. Okay. No respiratory diseases, nothing like that, asthma, anything like that. Good. Okay. Well, that's good. Okay. Just going to take a temperature. All right, 182. Let me get your blood pressure here for just a second, okay? No, ever been diagnosed with high blood pressure, anything like that?
Mm-hmm. I have family history of high blood pressure, but not myself.
Okay, who's got history of high blood pressure?
My grandmother on my mom's side, and also my papa as well. He passed away 5 years ago.
Okay. What did he?
He had high cholesterol, high blood pressure, of course, and he had cancer in his stomach.
Mm-hmm.
So he had a bypass surgery and cancer removed in the same surgery. And they neglected him in the hospital. And it's okay. That resulted in his death. But, yeah.
How do you deal with that?
I'm okay.
Okay. So is anybody else? You said he had stomach cancer in his stomach. Is anybody else in your family ever been diagnosed with stomach cancer?
No. My grandmother has past experience with cervix cancer. Cervix cancer,
Like female cancer?
Yes,
okay. Okay. All right. So no other stomach cancer though.
Mm-hmm.
Okay. All right. All right. Let me just take a listen right here. Okay. Sorry. Uncross your leg. Yeah, there we go. I'm sorry. be a little tight and uncomfortable, okay? Yeah, 112/76, that's perfect.
To be so non-compliant with my diabetes and stuff, pretty healthy kid.
Well, that's great. And your sports does, I'm sure, helps a lot of that. We just want to make sure that you stay that way. Stay that way as long as you can, okay? Yeah. All that looks pretty good. Heart rate is in the 90s. And our heart rate fluctuates, excuse me, up and down. Usually within about 5 beats or so, so that's not unusual, but it's around in the 90s. Your O2 sat, which tells us how much oxygen you have circulating in your blood, was 96%. Your temperature's great. Heart rate's great. You have any pain today?
Just in my ankle, so it's a high ankle sprain. Other than that,
On a level of 0 to 10, 0 being no pain, 10 being the worst pain you can imagine. What's your pain level?
right now it's about 4 or 5.
Okay.
It's calmed down a lot within the past month.
Okay. And you said that's with because of your ankle?
Yes, ma'am.
Okay. And how long ago has it been? Tell me one more time. I'm sorry. How long has it been since you had your ankle sprain?
About a week and a half.
Okay. Is there anything that you feel like aggravates it more or calms that pain down more?
When I ice it, it's numb, of course. But really with me moving it around a lot at one time, kind of aggravates it a little more. Walking a little bit is getting a lot better from when they first put me in the boot to now. But I think that's because the exercises that I'm doing on a daily basis.
So is 4 out of 10 with pain control, like with pain meds, or what is your pain level after you take, because you said you take ibuprofen and Tylenol for that?
Without pain medicine, I'd say it's about 5, but really with no medication at all, it's about 4.
Okay.
4 5.
Okay. All right. All right. And that may just take a little bit longer to kind of handle, okay?
Yeah.
All right. I'm just going to finish workup. Like I said, we're just going to kind of do a head to toe down, okay? Looks like, do you have any itching, burning, or stinging on the scalp? Anything that you're aware of?
No.
Okay. No bumps, nodules, cysts, or anything like that?
Not that I can.
Okay. No pain in the ears? Okay. Okay. All right. So I'm going to take a look at your eyes, okay? I'm going to ask you to follow my finger a little bit, all right? Start right here. Okay. Eyes only. Okay, perfect. All right. I'm going to put my finger right here, and I just want you to keep focused on my finger, okay? Right here. All right. Okay. Look straight ahead here at me. Right at my nose. Perfect. Right. Look straight at me. Okay. That all looks normal. Just making sure those pretty eyes are doing everything they need to do. Okay. Alrighty. So I want you to hold your arms out for me. Alright. I want you to try to push up on my arms as much as you can. Good job. Push down. Push down, push down, push down. Good deal. Same thing here. Lift this leg up for me. Okay? Try to push my hand up. Hard as you can, hard as you can, hard as you can. Good job. Now, I want you to try to push down on my hand. Down, down, down. Good job. Alright, this one's going to be a little bit harder to do, okay? So, let me know if I'm hurting you, okay? So, try to push my hand away. Okay, try to push my hand down. Alright, good deal. Can you do me a favor? Can you hop down for a second? Okay. Alright, stand tall. Okay, turn for me. And walk 5 steps that way. Right there, you can stop. Now come back towards me. Okay. Can you squat for me?
I don't think I can.
Can you get down as much as you can? Okay, come back up. Alright, good deal. Alright, you can have a seat. Just like to make sure you're able to walk, okay, with no problems, no issues, no dizziness, okay? Alright. Let me take a look at the circulation here. You trying to get sick? Have you been sick?
I've been, I feel like you had a little bit. I feel like I've been getting sick. I haven't told my mom yet. I will let her know ASAP.
Okay. Yeah, you got a little bit, not bad, but there's feels like a little lymph node right over here swollen. Okay, I just need you to lift your head up normal for me. Okay. And can you swallow? Swallow one more time. Okay. Just getting a feel of your thyroid. Do they check your thyroid when you go to the endocrinologist?
Yes.
Okay. All right. What about your tummy? Any problems with your tummy at all?
No. I have little scars here and there. I used to have a pump when I was little. I do take injections now.
Okay.
So I have little scars from that.
When was your last bowel movement?
I actually did before I came to the doctor.
Okay. Yeah. How often do you have a bowel movement?
Twice a day.
Okay. All right. I'm gonna ask you to lay back for me. Okay. I'm gonna just take a filler out of your belly. Okay. Okay. Gotcha. All right. All right. Can I pull your shirt up just about right here?
Yes,
Okay. All right. I'm just gonna take a listen really quick. Okay. Oh, look, there you go. Let me. Okay. It may tickle a little bit, sweetie. I'm sorry. Just feeling that I can hear the borders of where your liver is. So I'm just going to take a minute and just feel through here, okay? Let me know if you're having any.
I have a little bit of scar tissue just from my injections, but
I see in these little spots right there.
yes, ma'am.
Nothing too bad though. Looks like you might tan well in the summer.
Oh,
They
yeah.
go away in the summer.
I'm Italian, so my family, we tan really easily. We don't really burn, so we get really brown in the summer.
Ah,
Yeah.
there's nothing better than a nice tan in the summer.
Oh, yeah.
Okay. Just testing for some tenderness there. Okay. What about urination? You have any burning or stinging upon urination at all?
No. Sometimes when I have bowel movements, I tear a little bit. Is that just from not drinking enough water, or?
Bowel movements?
Yes,
What
ma'am.
is the consistency of your bowel movements?
It's hard. It's not any runny or anything like that. It's just.
Do you feel like you're constant? Well,
sometimes I feel like
you said you have 2 bowel movements a day, but
yeah.
are they hard or soft formed or?
They're hard.
Okay. Have you ever been diagnosed with hemorrhoids?
I have not been diagnosed with them, but I don't know. I haven't really been seen about them.
Is it something that causes you major discomfort, or it's just kind of normal for you and you manage it?
It's really just kind of normal for me.
Okay. Do you have bleeding in your stools?
Yes, ma'am.
Okay. How much would you say that you have? Is it just when you have a bowel movement, or is it?
A bowel movement. It's not when I pee or anything else.
Okay.
That's why I say sometimes I'll say just a little bit, but not.
Have you tried anything for it? Do you do anything for it?
No, sometimes I may put a little bit of ointment down there just to keep
What kind of ointment?
Polysporin, hydrocortisone cream.
Okay. Hydrocortisone cream is not bad. That's not but let's work on increasing water intake in your diet and increasing fiber intake. Do you know what kind of foods help with fiber intake?
Is it fruits or any kind of grain?
Veggies, grains and veggies. So let's add some oatmeal in there. Let's add some maybe rice, kind of wheat kind of stuff, and just vegetables. Good old nice. Do you like vegetables?
Oh,
okay. Like good leafy greens are always good. Broccoli's always good. So vegetables, all the healthy stuff essentially. Okay, that helps bulk some of that stool up a little bit. But one of the biggest things is water intake. Do you know how much water you should be taking in a day for a young lady your size and athletic?
A lot, but not exactly.
Almost a gallon, 3/4 to a gallon of water a day. Okay, our body naturally loses about 2 liters a day. That's just normal metabolic function. But for a young lady your size, and because you have a pretty thick stature, tall, athletic, you got a lot of muscle, that requires a lot of water. Okay, so definitely let's work on increasing. Would you say you take that much water in nowadays?
No, I've been working on drinking a lot of water, but sometimes it's hard throughout the day. But I'll work on it as much as possible.
Definitely let's kind of work on that a little bit. And guess what? When we take in that much water, that helps our blood sugars too. Okay, helps get some of that excess glucose out of the kidneys. Okay, all right. So nothing going on. Tummy's okay. Nothing major going on with that. What about female? You said you started your cycle when you were 12, around that time. But when was your last menstrual period? Do you know?
It was just recently. I just got finished about 2 weeks ago.
Okay.
So yeah.
Okay. So you don't know? Do you track your cycles?
Not like I'm supposed to, no. But with the next one on that's in my arm, sometimes they're irregular. Sometimes I'll go a month without having a period. Some days, sometimes I'll go 2 months without having a period. But I do still have them. They're not as heavy as they used to be. I was really heavy before I got the birth control put in my arm. But other than that, they're not really heavy anymore.
Well, the good thing is that's progesterone's job. Yeah. So progesterone keeps the uterine lining thin, and the uterine lining is what causes us to have a cycle. So if we don't really have that lining going on, then we don't really have a need for a cycle much. So that's not uncommon. But I will tell you, I always recommend to young ladies, definitely track your cycles. Because if you are having some issues going on, from a medical standpoint, I love to have that history from a patient because that definitely helps us figure out what the problem may be, and we can, expedite treatment instead of trying something first, having to try, well, let's track it first, let's see what's going on, then come back and see me. So oftentimes keeping up a good track of what you got going on is half the battle for us, okay?
So you mentioned that I could put like scheduling and stuff in my phone. Do you recommend like any other like
absolutely
apps and things that I can do to track myself?
There's tons of free apps out on. Do you have Apple or Android?
Apple.
Okay, so I know I love Apple. It's one of my favorites. But I know the Apple Store has free apps all day long. One of my favorites is Glow. It does. It helps you track everything down to your mood swings that day. So definitely, but something free, just so you can track any days that you're bleeding, have irregular blood, how much bleeding are you having, light, heavy. So it gives you a look and really what your body's doing. And what's amazing is when you track for a little bit and you start learning so much about your body you really didn't pick up on before. Yes, definitely. There's no one particular one that I would say you just have to have because everybody has different preferences. But I definitely love the Glow app. That's one of my favorites. But I would say start tracking it. That'll help you really get an idea of how your whole body, because as females, our whole body is driven by our menstrual cycle. Our everything from our moods to our skin being dry versus oily. I mean, all kinds of cool stuff. All kinds of cool stuff. I noticed you have a tattoo here. What's it say?
It says type 1 diabetic, and it has my diagnosis date.
Cool.
Me and my mom and my grandmother got matching tattoos, so they have it on their wrist as well. It says hope on it, and it has my diagnosis date.
Cool.
Are
you close with your family?
Yes,
Sounds like it.
Close.
Sounds like it. Okay. So you have a good support system?
Yes, ma'am.
Awesome. So any past surgeries at all ever?
No, I've never had
Okay.
any.
All right. All right. So your last menstrual period was a couple weeks ago. No burning or stinging when you urinate. No difficulty urinating. What would you say the color of your urine is?
Like a not dark yellow, but not light either. It's like right in the middle of a mild yellow.
Okay, good deal. So we like it light yellow. Definitely light yellow if we can. If your urine is like water for you, that may not necessarily, if you're peeing a lot and it's very, very clear like water, that's not good. That can oftentimes tell us that you need to check your blood sugars if you see that. But in general, if you're urinating every couple hours, sometimes 3 to 4 hours, especially as busy and going and doing as athletic as you are, with a light yellow, you should be pretty good. Okay? All right. Questions? Do you have any questions for me? Okay. Okay. So make sure you follow up with your leg. Okay. Any further issues you have, make sure you stay compliant with physical therapy. I would definitely say, we've talked about as I've went on, through your body systems with you, I've done a lot of education with you. So we'll make sure we get you some of that information today. Make sure you find an endocrinologist. So I'm just trying to talk about the things that we need to make sure you follow up on when you get home, okay? So let's work on compliance with your Celexa, okay? Let's work on trying to be a little bit better with your compliance. I know Rome wasn't built in a day, but definitely your diabetes management, I promise you, kiddo, that will make more of a difference in your world, not just physically, but mentally. And all the way around, you'll feel so much better, okay? But you got to start somewhere. So if you're not being compliant with taking your insulin, you got to do that, okay? How often would you say you check your blood sugars every day?
2 to 3 times a day. I should be checking it a little more. Especially with me playing sports, I should be checking before practice or before the game, just to make sure that I'm on the right track.
This is the best way I always tell my patients, because sometimes we forget about how important checking blood sugars are.
Yeah.
And it's kind of like, I get so tired of checking it. But you got to remember, anything that we do that is going to make a change in our blood sugar is when we need to check it. So eating, doesn't that make a change in our blood sugar? Definitely. Sports, what happens? We play sports, our muscles use up all that energy, all that glucose, and then that glucose goes away, so then our blood sugar drops, right? So those are things that change our blood sugars. When we're sick, right? So if I'm throwing up a lot and I'm not taking in a lot of food, can't that change my blood sugar? So stress, when we go through stress, okay? We have fights with our family or our significant others, or, we have somebody passed away in the family, or just stress in general, with the lifestyle that you have as far as sports and school. And so anything that causes stress can change our blood sugars, right? So that's a good rule of thumb, is anything that you feel like can change your blood sugar, that would be a cue, I need to check my sugar, okay? And maybe thinking from that aspect, instead of looking at it up the mountain, like, oh my gosh, I got to check my blood sugar 4 to 6 times today. Look at it more of, okay, where in throughout my day is my sugar going to change the most? And that time, when you hit those moments in your day, go, I'm fixing to eat. This is going to change my sugar. Let me check it. I'm fixing to go practice for 2 or 3 hours, or I'm fixing to go do a bunch of cardio, or so that way sometimes that triggers your brain to, let me check that sugar, instead of, oh my God, this is time number 2, this is time number 3, you know what I mean? So sometimes just training our brain to think a little bit different can make a huge difference for us, okay? Just remind, what about insulin? Do you take your insulin like you're supposed to?
Most of the time, yes. But sometimes I don't take it. Like, I take it, but I don't take it when it's needed. So I need to really take it before I eat.
Mm-hmm.
But most of the time, yes. Sometimes no.
Well, insulin is designed, especially Novolog that you take, it starts working within like 10 minutes of you taking it. Okay, so food's the same way. The moment you take that first bite of food or drink that has sugar in it into your mouth, your sugar is going to start rising. So if you are eating, your blood sugar starts to rise, but you don't give insulin till over here. Your blood sugar's way up here before insulin can start working over here. So your blood sugars are always up, and then by the time your blood sugars start coming down is when you've gotten your insulin so late that it's now peaking. When are you getting blood sugar drops like 2-3 hours after you take insulin sometimes and you feel really bad? No, but they just say how all the time. Okay, that's because there's no balance. We ideally like to eat and insulin at the same time, so that on, like, if we were to plot sugars on the graph and we were to plot insulin and its onset and peak times on a graph, that they literally look like they're together. They're running parallel with each other instead of our blood sugars up here and our insulin over here. Okay, so we really want them running together like two cars in a race that are neck and neck all the time, is what we would really prefer if we're looking at it from a graph perspective. Okay? So I know you can work on it. You know, if you're getting into that time of your life where you're independent and you're going and doing, you know, let's do what big girls do if we're doing big girl things, right? Okay. I think you can do it, especially if someone is so driven to be as busy as you are. And for somebody to play 3 sports like that, they're a very competitive and very dedicated person. That I do know. So if you're dedicated to being great in that aspect, and at school, how are your grades at school?
Pretty good. I do well in my classes.
Okay. So to keep up with your grades, keep up with your athletics and sports, you have to be someone that's dedicated and has a vision of a future for yourself. So in order to make all that, I mean, we should be able to do the same thing with our blood sugars, right? So be as dedicated to that as you are everything else, and the sky's the limit for you, kiddo. It really is. Okay? All right. Well, if there's nothing else I can do for you today, everything looks pretty good. You know, we've talked about things that we could definitely improve on and go from there. Does that help some?
Yes, ma'am.
No questions.
No
questions. All right.
Thank you.
Well, it's nice to meet you today.
Nice to
Thank
meet
you
you
so
too.
much for your time.
Yes,
all right.
Thank you.
Thank
so
you.
much.